Hello everybody. Today we're going to discuss the common causes and treatments for hair fall. I'm Dr. Kiran Attili. I'm a consultant dermatologist at Visakha Institute of Skin Allergy, Visakhapatnam. Hair fall can be a very severe problem for some people, but in the majority of cases, it's reversible, especially if it's caused by something like stress, vitamin or iron deficiency, or even thyroid insufficiency. However, if left treated for many years together, stress and vitamin deficiency can also lead to permanent hair loss. So it is important to get your hair loss treated immediately. Now, there are other conditions like balding, what we call androgenetic alopecia, particularly in males, where there is visible thinning in the scalp. Now, this is easy to reverse in the initial stages, but if left to progress for many years again, it can become irreversible. So for this, there are various treatments available which we discuss, but there are specific skin conditions like alopecia areata, lichen planopilaris, discoid lupus erythematosus, which, like in this case in the picture, can cause marked scarring and permanent hair loss. Now, you may ignore this and feel that this is a simple problem, but if left alone, this can cause permanent damage. And particularly if you're seeing patches of hair loss, please get that seen to by a dermatologist immediately. Now, most people are worried whether their hair fall will become so severe that they will need a hair transplant. Let me tell you, the picture on the left is showing a person with diffuse hair thinning. In these cases, definitely, please do not go for hair transplantation, because at this stage, hair transplantation is unnecessary and sometimes can be detrimental. You have the hair roots here. The hair roots are visible, as you can see in this case. Now, when the hair roots are visible, we just need to strengthen them. And in most cases, lotions, tablets, and PRP treatment, platelet-rich plasma therapy, suffice. Only in cases like this, as in the picture here on the right-hand side, where the scalp is completely bald, where the roots are completely gone, do you need a hair transplant. In most of the cases, serums, tablets, and injection treatment in the form of platelet-rich plasma therapy are all that are needed. There are other treatments like stem cell therapy and growth factor concentrate, which are now coming up, but these are just more expensive versions of platelet-rich plasma therapy and are no more effective than simple platelet-rich plasma therapy, which I'll discuss in a second. So when do we do a PRP treatment? It is in these cases like this. This is a female with balding. This is a male with balding where there is diffuse thinning with no actual loss of follicles, but just the hair follicles have become extremely thin. In these cases, we do PRP where we take your blood, isolate the platelets within them, and inject these back into the scalp. Okay, this is a very safe treatment. Takes about half an hour to 45 minutes. We give a local anesthetic injection to numb the pain. But there will be some pain, but that is the only side effect. It's fairly side effect free. If we do these sittings once every month for about 3 to 6 months, that will stimulate your hair growth. Okay. Now, apart from this, there are tablets that we give, and it's important to take the tablets simultaneously. So you can see here in this patient with the combination of tablets, lotions, and PRP, there's excellent improvement in the hair, in the scalp here that you can see. Okay. So the reason I made this video is that nowadays people are extremely concerned about hair loss, and they're now going to various salons, hair parlors, and buying package of 50,000 and 1 lakh and wasting a lot of money on these sort of packages. Please be assured that you don't need to spend that kind of money. Yes, PRP treatment is expensive. It costs about 5,000 rupees per session in my clinic. Some people may do it for much more expensive rates, for about 10,000 per session. There are people who may do it for about 3,000 per session, but PRP is very effective. Okay, but don't go for expensive packages, and definitely don't go for hair transplant, especially if it's done by dentists and other people who have no knowledge of the skin. If you're getting hair transplantation done, get it done after taking advice from a dermatologist. If medical treatment is ineffective, hair transplantation is not the first choice of treatment. Most cases of hair fall can be reversible with medical therapy, and yes, certainly if you consult a dermatologist at the earliest, that is the best. Thank you very much.